There you go. And we can start.
Okay.
maanta waxaan ka hadlaynaa for those of you oo aan afka ku hadlaynin waxaan ka hadlaynaa waxyaalaha oo markino ka hadlayo birth controlka iyo sidii markino lisaga xiro dhalitaanka ama lisaga control insha Allah ayaa laga hadlayaa maanta. So you can go.
Okay. So we'll introduce ourselves and then I will attempt to share my screen and we can go through the PowerPoint, and feel free at any time to interrupt us with questions. Would like this to be both a conversation and for you to share knowledge that you have as opposed to just us coming in and sharing the knowledge that we have. And so really feel free to ask as many questions or as few questions as you like throughout it. My name is Maya. I'm one of the doctors at the First Hill residency. I'm a second year and I'm at the Ballard Clinic up in Ballard.
My name is Molly. I'm also one of the resident doctors. I'm a first year resident and I'm at the First Hill Clinic right on like the main First Hill Swedish campus.
Joe, you're muted.
Oops. Hi, sorry. I think I'm back now. My internet cut out for a second. But my name is Joe. I'm also, like Molly, a first-year resident, and I'm also at the First Hill Clinic right near Swedish First Hill Hospital. So happy to be here.
Thank you, ladies.
I think I need to be made a co-host in order to share
yes.
my screen.
Definitely, I'm gonna make you co-host. There you are.
Oh, wonderful. Thank you.
Welcome.
Okay, let's see if I can successfully do this. Do you see the, oh gosh, this made my screens look so strange. Okay. All right, do you see just the slide?
Yeah, that's perfect, Maya.
Okay.
Perfectly.
Great. So we've kind of broken down birth control or contraception into different categories. And so we're going to each go through the different categories of both hormonal, non-hormonal, the short-acting ones, the ones that are long-acting and reversible, as well as permanent methods. And take it away. And just let me know when you want me to advance the slides.
You want to go ahead, Maya?
Yeah, I'm doing the last part. Great, yeah.
Cool. So I'll get started talking about some of the hormonal options for contraception. The first, so hormonal meaning using either or both estrogen and progestin, which are hormones that are kind of naturally occurring throughout the body, and when applied to contraception can prevent ovulation and make other changes in your body that that prevent pregnancy. So the birth control pill is one that many people are familiar with. Some contain both estrogen and progestin. Some contain just progestin alone. That type of pill tends to be, it's more important to take that kind of pill at the same time every single day that you're taking it. One important thing to know about the birth control pill is that when using this method, you don't get any protection against STDs. Something that's true of any contraception that contains estrogen is that if you smoke cigarettes or have a history of certain health conditions like blood clot or migraines, this might not be a safe option for you. And one thing that some people sometimes have challenges with the birth control pill is that you do have to take it at the same time every day or it's less effective. And again, with the type of pill that only contains progestin and no estrogen, that's even more important to be super regular about the time of day that you take it. So some people set alarms on their phones or on their alarm clock or have other ways of remembering exactly what time of day they take it. These are relatively affordable forms of contraception. Most insurances, in fact, all insurances should cover it. One benefit that some people like is that there can be improvements in acne with the birth control pill. Sometimes people who have really bad premenstrual symptoms like cramps or mood swings see some benefit and change in those symptoms when they're on the birth control pill. But there's also a whole bunch of other side effects that people get at times. They can cause some nausea, some weight gain, some headaches. And for some people, it just takes kind of trying different brands of the pill, and there's several different sort of dose changes, like there's smaller or lower amounts of estrogen and progestin among some different brands and formulations of the pill. And sometimes it just takes experimentation with a couple different types before you find one that doesn't give unpleasant side effects. Another upside is that unlike some of the methods that we're going to talk about later, there's no procedure required. It's just taking a pill. It's pretty non-invasive. So go ahead, Maya, and we'll advance the slide. I also want to say, if anyone has any questions, feel free to just interrupt. We'll definitely have time for questions at the end, but if something that I'm saying sounds weird or you have a question about it, just stop me. Another option for people who are looking at hormonal options of contraception is the patch. So similar to some kinds of the birth control pills, the patch contains both estrogen and progestin. Because it's not something that is like a barrier between body parts, it also does not protect against STDs if you're using it as a way to prevent pregnancy. Because this also contains estrogen, it might not be safe if you smoke cigarettes or have a history of some of those health conditions that we talked about. That includes, blood clot, high blood pressure, migraines, and sometimes elevated BMI. I'm just getting a note from Maya that we actually did have a question. Did somebody want to ask a question before I go on? If not, that's fine. I'll just keep going, and then we can stop at the end when we change speakers for a question. So the patch works. So it's a patch that you can put anywhere on your body. So in the diagram here, some people like doing it kind of on their the inside of their hip, under their pants. Some people like on their arm. Other people like on their back or on their shoulder. And the way it works is you place it once a week. It stays on for the entire week, and then every week you replace it. So you get kind of 3 patches per month. And then for the 4th week, you don't use any hormones at all. And then that's when you get your period. Again, like the pill, there's no procedure required. One thing that people sometimes don't like about the patch is that it can just cause some irritation at the place where it's sticking on. And then there's just sometimes some problems with it falling off or being sort of irritating to wear something like externally on your body. Finally, we have the ring, which again also contains both estrogen and progestin. So the same kind of thing with the pill and the patch, also not getting protection against STIs like chlamydia and gonorrhea. Also not safe because it contains estrogen. If you have some of the health conditions that we talked about, like high blood pressure, blood clot, tobacco use, or migraines. The ring works by actually placing this little really flexible plastic ring inside the vagina, and sort of like the patch, you change it every week. So you kind of wear the same ring in the vagina for a week, and then change it 3 times until the 4th week of the month is when you have your period. Sometimes people can actually just leave the ring in for longer than a week. If they want to sort of skip a period, it actually works fine to just leave it in longer and sort of use it continuously to skip periods. And sometimes people will do that if they want to have a period like once every 3 months instead of once every month. Sometimes people notice that they get some increased vaginal discharge with the ring. It's also maybe not a great option to, it's also not a great option to, oh wait, sorry, I'm getting a whole lot of texts. No, also not a great option for people who don't enjoy sort of like manipulating things in their own body parts and like don't want to place something in their own vagina. Maya, I think, do you want to jump in and kind of just explain sort of what you're talking about in the talking about in the chat? Okay, never mind. You can't unmute because her computer froze. So actually, no, thanks for the correction. So actually, instead of changing the ring every week, you actually use the same one for 3 weeks, and then after, and then change it after 3 weeks. And then we can advance the slides. And sorry, I'm doing this from my phone because my internet actually went out. Finally, we have the shot, which uses, instead of both hormones, it only uses one hormone called progestin. That hormone works by actually preventing ovulation. You actually aren't releasing an egg from your ovaries anymore. So there's like no egg that can get inseminated. This is a birth control that you get one shot, and it's good for 3 months. One of the benefits of it is that it can be associated with some shorter and lighter periods. Sometimes it's associated with some weight gain. And then another benefit is that you can breastfeed with it. One thing that some people really like about the shot is that it's private for the user. So unlike a ring, which sometimes can be felt by partners during intercourse, or a pill, which is something that you're maybe leaving around the house, the shot is something that you just go to a clinic once every 3 months and you get a shot, and nobody else has to kind of know that you're using a form of contraception. You can start getting the shot right after delivery, and the effects can last for up to 6 months after stopping it, which is something that's important. It's not a form of contraception that you can immediately get pregnant if you stop that form. I'm going to pause just for 1 second because I think that we need to do some workarounds with
let me see if somebody needs interpretation. Gabdo, qof loo turjumaanayo ma ku jiraa? Gabdo.
Ani waa ku jira aniga wax ma fahmin qaarkooda.
Haye.
Waxa waaye waxyaalaha la iskaga celiyo
dhalmada
uurka. Tan waxa waaye tasharootada kuwa kaleetana ma fahmin koley un.
Kan hadda ay ka hadlayso waxa waaye cirbada waaye. Tan hadda ka hadlayso cirbada waaye. Tii ka horeysay waxay ka hadlaysaa waa aneelihi. may kii kan wareegsanaa waxay ka hadlaysaa aneelihii waaye. Kan kale ka horeeyay waxa waaye cirbada aneelaha iyo waxay ka hadashay kan oo lagu dhagsanayo jirka ama gacanta hoosteeda. Okay.
Ama barida ama maxaa hayta ama gadaal dhabarka.
Ama gadaal dhabarka kuwaas sida u kala duwan yihiin ay ka hadlaysaa. Marka waxa ugu dambeysay ka hadlaysa waxa weeyaan tan la isku duraayo. Cirbada 3 bilood every 3 bilood isku duraysaa midkan. Can we go the one before that? Okay, kanna waxa waaye waxa la gashanayaa wiigi hal mar. Ayaad xiranaysaa waxay ku wacaan ring.
may saacada waxa waaye hal mar ay gashanaysaa 3 wiig ku jiraa. Wiigi afraad aad bixinay caada ku dhacaysa wiigi afraad saas waaye kan faraantiga.
hal mar ay gashanaysaa 3 wiig ku jiraa wiigi afraad marka bixis caada ku dhacaysa Soomahan. laakiin caadada markay kugu dhacdo ma iska bixinaysaa mise markay caadada kugu joogto ma gashanaysaa?
waxa waaye marka iska bixis caada ku imaanayso the 4th week.
The 4th week you get your period.
And if you decide that you don't like getting periods with the ring, you can just leave it in for 4 weeks and take it out and put in a new one right away and not have a period. And it's just as safe to do that. And it can last actually a little bit longer than 4 weeks. So some people like to just, it's the first of the month, I take out my old one and put in a new one. And so you're not having to count the exact weeks, but knowing, because it can last at least 31 days. So you can just think to yourself, on the 1st, I take it out and put in a new one and I don't have a period. Or if you decide, I do want to have a period, you take it out after about 3 weeks, and for 7 days, it's not in, and then you will have a period.
haddii laakiin aadan rabin inay caado kugu dhacdo haddaad bixisay 3 satimaan ka bacdi mid kale haddana cusoo hore ka gelinaysaa laakiin haddaad rabtid inay caado kugu dhacdo markaa ka bixisid ha gelinin mid kale caada kugu dhacayso. Okay, badge, can I see the slide of the badge?
سعاد ما كسو علين كرتا also cirbada waxa ay leedahay mar labaad ay fasiri karayso cirbada
ها هي كنا وحالة لها patchka كان واركت أملنا أما واحد كحرين كرتا in replace contains a strong hormone
kan koolada waay ha
كان وكولة ذواي جركا ميل والبعض كحرين كرتا أو كمية عجركا in the weather in قربكم كحرين كرتا
ha
once a week كنا week هل once at 3
So you put one on for a week, and you leave it there for a week, and then you take it off and you put on a new one for a week. Take it off, put on a new one the third week, and then take it off, and then your fourth week you don't have a patch at all, and that's when you have your period. And this is one where they do recommend having a period every month. You can't do it. You can't choose to not have a period with it.
كان waxaa lagu ogol yahay in caado kugu dhacda laga rabaa laakiin week hal mar aad ku xiranaysaa in week walba hal mar aad ku xiraysaa saddexda week markay kugu dhamaato waa sugaysaa caadada kugu dhacaysa week afraad marka caadada ka bacdi haddana waad meesha ka sii bilaawaysaa kan caado la'aan laakiin inaad ahaatid lama rabo waa in caado kugu dhacdaa. Okay, good. Somebody else asked about the Deborah. Can you go back to the Deborah? Okay. Kan waa maxaa la dhahaa in kii cirbada isku dhufanaya waa kan birth control for 3 months kan 3 bilood waay 3 bilood ba hal mar lagu dhufanaa waa inaad clinic tagto oo soo qaadato shortens light period. When you say shortens lighter period, what do you mean?
So some people will have if they used to have periods of 4 days, they only have it for 3 days or 2 days. And the flow is sometimes a little bit heavier. Some people it's the same. And some people don't have a period at all. It's a little bit unpredictable, but most people will have shorter and lighter periods.
dadka qaarkood cirbadaaniti 3 bilood hal mar every 3 bilood waa inay hal mar qaataan dadkii 4 bilood tabcan ka soo qaad caado ku dhici jirtay macnaa caadada socon jirtay waxa laga yaabaa inay ka yaraato laakiin qof walba isku mid ma ahan jirkiisa dad waxa laga yaabaa inay xoog ugu socoto dadna waxa laga yaabaa inay xogaa yar macnaa ka istaagto xoog ay u soconin. All of this contain hormones, right?
Yes, these are all containing hormones, and then these all the ones we've talked about so far also prevent ovulation. Everything with estrogen in it prevents ovulation. The Depo doesn't have estrogen; it's just progesterone, and so you can use it if you are someone who's over 35 and smokes, or you're someone who has the migraines with aura, so you see things before you get a migraine. So we'll get to the non-hormonal ones at the end.
Okay. waan ka hadlaynaa ku tiro hormoonka maxaa la dhahaa siday u effect garaysa korka tan oo shaadka waxaa qaadan kara dadka oo 35 sano wixii ka weyn dadkii sigaar soo cabi jiray markay yaraan or like a person who smokes cigarette like currently can take also the Depo.
They can, and if you're under the age of 35 and you smoke, you can take the other ones as well. But if you're over the age of 35 and you smoke, you can only use ones that are progesterone or non-hormonal because the estrogen puts you at a higher risk of having a blood clot.
Progesterone maxaa lagu dhahaa Somali ahaan? Okay, I'll figure it out, guys, what to call progesterone while you guys talking in Somali.
Okay.
I'll Google it. Okay, we can.
Sorry, Doctor, can you repeat that last statement, please?
Oh, about the difference between the progesterone and the smoking?
About people with heart conditions, I think I missed.
Yeah, so if you have certain heart conditions that put you at higher risk for a blood clot, or if you're someone who's over the age of 35 and smokes, or you have uncontrolled blood pressure, they don't recommend estrogen-based birth controls. So that would be the ring, the patch, or the pill. But ones that have only progesterone are safe in for those people, and so you can use the shot, which we're talking about now, as well as we're about to talk about the IUD and the implant, which are both progesterone based and are safer in people who have those conditions.
Thank you.
Do you have any question or anybody has questions? سؤال ما قبتها حبيبتي in so far.
ما يبغى.
We can go.
Okay, so I'm going to talk about sort of what we call the long-acting reversible contraceptions, or you may have heard of these called LARCs, and they're ones that last longer. So this is sort of an overview about LARCs in general, and then we'll go into the different kinds. So one benefit that some people enjoy, some people don't like to take a pill every day or remember to change a patch or a ring. They find that hard and then are worried that they'll miss a dose. So the nice thing about a LARC is that you put it in and then it usually lasts for up to 3 to 12 years, depending on what kind you have, and you don't have to think about it every day or change it out ever until it's expired. The other nice thing about it, I think one myth some people hear about the LARCs is they're worried that they wouldn't be able to get pregnant once you remove it. And so that's one nice thing about them is that you can remove them at any time and then be ready to try getting pregnant. They are some of the most effective methods of birth control at preventing pregnancy, so up to 99.99% effective. The one other thing about them is that they do not provide any STD protection because there's no barrier method like a condom would provide. And then most of these methods require a small procedure in the hospital or in the office to place it and also to remove it. Next slide, Maya. So the first one we'll talk about is called the Nexplanon. This is one that you may have heard of. It's the implant into the arm. It's a progestin method of birth control. It's effective for up to 5 years, but you can remove it at any time. Like I said before, if you're wanting to get pregnant, maybe 2 years after you put it in. It can cause some unscheduled bleeding, so like breakthrough bleeding, or it can also decrease and stop periods. Like a lot of these, you don't really know how it's going to affect your bleeding pattern until you have it, and every person is a little bit different. And they're also nice in the hospitals. They're very commonly used right after delivery because they don't have the estrogen in them. They're safe to breastfeed with and have right after delivery. There's a little picture of it right there. It's next to the match. So that's what it looks like for size. And then the arm shows where it goes. So it's kind of inserted into the arm right there with just using a little bit of anesthetic. And the procedure takes just a couple of minutes. The next ones are the intrauterine devices, or otherwise known as IUDs. So these are also these are progestin, or there's actually two kinds. So there's a Paragard, which is the one on top, and that's non-hormonal. So if someone's wanting an IUD, this is a device that's actually going to be implanted directly into the uterus. So you can do this after delivery, or in an office. You come in and it's a procedure where a physician or a provider will insert the device into a uterus, and then it's good for a number of years. So the first one on top that's listed there is the Paragard, which you may have also heard of before as being called the copper one. That can last up to 12 years for effective birth control, which is really great. And then it also doesn't have any hormones. So some people really like that part if they're wanting a birth control method that they don't have to think about every day. But if they're not wanting to use hormones in their body, the way that it works is the copper essentially creates like a little toxic environment for sperm so that the sperm can't implant to the eggs. It can make people's periods heavier and crampier, and people usually do have consistent periods. So this is also a really nice method for people who still want to continue having a period while they're on birth control. Down on the bottom are listed out some of the names of the hormonal IUDs. So these are all progestin hormone secreting intrauterine devices. They last for anywhere from 3 to 7 years. And again, they can be removed at any time. And often these actually make people's periods lighter or go away altogether. So I think the biggest difference I see between these two in the office is either women want no hormones or hormones. So that's why you would choose one or the other. And some women really like having a period, and some people really don't like having a period. So those are sort of two ways you can sort of tease out which one is right for you. And the other thing too, just to know about the intrauterine devices compared to the implant in the arm, is that when it's in the uterus, the hormones, if they're there, are just acting locally on the uterus and not going through the body at all. Whereas when it's in the arm, then you have hormonal exposure through the body. The next slide, we're going to talk about permanent methods. So these are less reversible. We'll first start on the right. This is a vasectomy. So this is actually the procedure on a penis. And so this is a procedure when someone goes into an office, into a doctor's office, and it's a little surgical procedure where you actually cut or block the tubes that carry sperm from the testicles out for ejaculation. And so the penis is no longer able to deliver sperm to the vagina. This procedure is also 99.99% effective, but you don't achieve effectiveness until up to 3 months after. So you still might need to use birth control in that time period if you're wanting to get, if you're wanting to not get pregnant. And what's interesting about the vasectomy is depending on how they do it, they actually can be reversed sometimes. So usually with these two procedures on this slide that we're talking about, the biggest side effect we say is regret because they're generally less reversible. But the vasectomy can be reversed in some cases. It's a pretty fast recovery, just 2 to 9 days, and it can be done in the office, so no general anesthesia is needed. On the right side, we'll talk about tubal ligation. So this is in the uterus when in the birthing person, when we tie the fallopian tubes off or remove the fallopian tubes so that it becomes physically impossible for someone to get pregnant. So this is surgery, usually laparoscopic, meaning using cameras or sometimes open, but someone needs to be either under general anesthesia or have a spinal block left over from a delivery. And what happens is the doctor or provider reaches in and grabs the fallopian tubes through 2 very small cuts and removes them. It's permanent, so it's very effective, but it cannot be reversed. And then the recovery time is a little bit longer because it's a surgery in the belly. And then anytime you do any surgeries in the belly, there's always a risk of things like infection, bleeding, pain, and things like reaction to anesthesia.
And I just wanted to add one benefit that they've discovered recently with tubal ligation. They believe that ovarian cancer actually starts now in the fallopian tubes. And so in people who've had their fallopian tubes removed with a tubal ligation have lower rates of ovarian cancer. And now I'm going to talk about the different non-hormonal options that exist. Molly already did a wonderful job of talking about the non-hormonal IUD.
Before we go back into that, can I explain?
Of course. Yeah.
Okay. One before that one. Yeah. Oh yeah, that one. Sorry. Nasteexo. Kan waxaa la dhahaa waxaa la geliyaa gacanta hoosteeda. 5 sano ayay kugu jiraysaa. Laakiin caado way kugu dhacaysaa. Caado way kugu dhacaysaa, laakiin caadada ma badna.
Waa si irbad oo kale miya?
Irbad camal uu egyahay, laakiin jirkaaga markan gacantaada hoostooda garabka hoostiisa ayaa la gelinayaa hormona ku jiro hormonkaasayto ayaa jirkaaga ayuu siinayaa.
Markii laga bixinayo waa la qalamiya.
So this is like a surgical when they put it in and when they take it out. It has to take a surgery, right?
It's a very small procedure in the office. So it takes about, like, to put it in takes about 5 minutes. So they numb up the area and then they just insert it kind of with this little tube. Yeah. So I don't consider it a surgery. I think of it more like a very minor procedure. They use the same numbing medicine that a dentist use when you're having a cavity.
Qalitaan ma ahan, laakiin sidii markaa tagtay dentistaha oo kale geedka markaa kawaabisada oo lagu kawaabiyanayo maxaa la dhahaa iliga markii laga bixinayo kale kawaabisadaas la marinayaa markii meeshaas la gelinayaa waa geed yar waa saas oo kale sidii markaa taraq oo kale ay la eg tahay
wajeeda
laakiin meesha lagu dhaafaya jirkaaga dhexdiisa lagu dhaafaya. Can we go next? Anna waa IUD-gi waaye.
Kan waa aqaana laakiin ayaguna
kan labay kala yihiin midna waa 12 sano mid waaye mid aan hormone lahayn iyo mid hormone leh kala yihiin. Mid waxa waaye maxay raadaan waxay siinaysaa caado oo xogaa yar oo badan kan 12 sano ah kan kaleetana waxa weeyaan ilaa 3 sano 3 ilaa 7 sano ay kugu jiri kartaa bacdi waa iska bixin kartaa kaas hormonkiisu waa iska fiican tahay saas ma u weynaa caadadaadana way kugu dhacaysaa bil walba laakiin caadadada ma yara macnaa ma weyna dhiig badan kama baxayo okay good. Okay, next one.
السلام عليكم.
وعليكم السلام حبيبتي.
بايو إن وعن قاتا كنينك مركا وعن روا كنينك مولاي هاي ديك بدن أنا وعن كو أركي وقت بدن إجا ما مقنانا مركز تو إيمانا يا إن 5 days كدبو إيمانا يا ساسميا إن ويديانا واسلانتا.
Okay. So, another person has a question. But let me finish this one. كان waxaa ragga lagu sameeyaa ragga laga xiraa meesha dhalmada ee soo marayso maxaa la dhahaa in sperm maxaa lagu dhahaa gabdho ee caawiya af Soomaali kuma garanayaani
biyaha nimanka biyahooda waaye
ragga biyahooda meesha soo maray biyaha ma arkaysid adiga macnaa biyahooda still way ka soo baxayaan laakiin meel ma arkino waxaa jirta laga xiraa ragga laga xiraayo tan waa
shahwad
waa laga xirayaa kan waa ragga dhinacooda waay kana naagaha waay dhinacaanayto meel ilma galeenka tubooyinka laga xirayaa ilmaha haddii rabeen macnaha inay iska dhaafaan naagaha rabo inay dhaafaan in laga xirayo marka 4 bilood 4 week camal ay ka qaadanaysaa markii ay recoverygeeda macnaha ay kusoo fiicnaanayso and somebody else have a question she says she takes the pill maxaa tiri macanto abaya maxaa tiri
بايو وحان قاتا كنينك مركا كنينك مركا قاتا حاجة wax yarba ma maqnaana uu iska imaanaya 5 days 6 days kadib saasmiya ciladaas mise waa cilad kale waa fahminaysan
I take the pills but I get my periods right after 5 days and bishi hal mar ma ku yimaada mise wuxuu ku yimaada marar badan
oo imaada baayo
I get my periods often in a month and I'm on the pills.
And so you're getting your period more than just once a month during
yes.
Okay. So I would talk to the doctor that's prescribing that for you because most or which type of pill do you have? Is it the progesterone only one or is it the one with estrogen and progesterone?
كيف قادتها كان progesterone كأها مثل كان estrogen and progesterone isugu jiro magacii muxuu ahaa
yaraha baaniga waxa way klinka caadiga oo birth control bay dhahday magaciisa ma garanayo ilaa hadda aan mito sikara way dhaqmaan
I don't know what's the name of it I can show you she just told me this is just a birth control here take it
okay I would talk to your doctor about it certain pills especially the ones that are progesterone only can cause a lot of spotting and breakthrough bleeding because they don't work by affecting ovulation. They work by making the cervical mucus so thick that sperm can't go through it. And so with that, you're having this continuous level of progesterone, but the lining of your uterus still sometimes will grow and like go during that time. And so you will sometimes get spotting and breakthrough bleeding. So I would talk to your doctor about which pill that you're on because there's so many different types and it may be better for you to be on a different brand of the pill if that's happening to you.
ما عنده حي قلت لها دكتور دا وإن الله هذا شيء كي قادتها ذي تسبب
كاميرا وان فرتين أنا عارفة
صار ماشي صار وجهي صار ماشي ده وده صار
جاكوا يا فيرين
I'm not sorry my computer is having a lot of trouble both hosting the PowerPoint and seeing people's screens
me too,
so I can't see it quite well is the pill the same color throughout the month
كلغود isku color waaye
yeah all of them
colorkoodana waxa way pink waaye wait
they're all are pink
pink so you're probably on the type that's only progesterone and having these breakthrough bleeds or this spotting at different times during the month is a lot more common with that type. So I would talk to your doctor about maybe being on one that has both estrogen and progesterone in it.
waxay ku tiraahday kaniinkaasayto hadda qaadanaysid saas way ku dhacdaa gabdhaha oo qaataan waa lagu talagalay inay caadada ma arkin oo saas ay kugu timaado bishii marmarka qaarkood laakiin waa inaad dhakhtaradaada aad la hadashid aad u sheegtid si ay kaaga bedesho oo kaniin kale ay kugu qorto
Okay, cirbada oo 3 bilood kadib la istiraay iyada maxay infectiga ay leedahay maxaa waaye?
Can you tell me more about the bro?
The shot?
Yeah, the shot, yeah.
Yeah, so the shot, it's the same exact medicine as what's in your that you're taking, and it's just like similar to a vaccination. It's a shot just like that, and you get it every 3 months, and it works by also affecting that mucus on the cervix to prevent sperm from getting in. It also has a side effect of having that breakthrough bleeding or irregular periods, and some people have shorter, lighter periods. But it works for 3 months, and you just have to visit your doctor every 3 months to get another shot.
horta cirbadaasayta 3 bilood mar inaad dhakhtarka tagtid waaye oo lagu soo diro haddana maxaa la dhahaa dadka qaarkood dhiigga macnaa dhiig badan oo macnaa heavy ah ma ku dhaco dhiigga xoogaa yar wuu ka yaraadaa laakiin naagaha haddana isku mid ma ahan kuligooda gabdhahaan si fiican u turjumaanayni caawiya xoogaa yar maskaxdeeda spaces out very easily yani. Okay, somebody else has a question on the chat. Okay, each woman's body can react differently. Okay, yeah, that's it.
It's true, and none of these are fully are 100% effective. Really, the only form of birth control that's 100% effective is either not having sex at all or having your whole uterus removed. But that's not a procedure that gets done regularly. But the
you mean hysterectomy?
Yeah, hysterectomy. Okay. Because if there's no uterus for a fetus to grow in, it can't grow. But yeah, none of these are perfect, but the ones that are the most effective are the vasectomies, the tubal ligation, and the Nexplanon in the arm. And the Nexplanon in the arm is actually slightly more effective than getting a tubal ligation or your tubes tied. Okay. We can start talking about the natural options as well, the hormone-free options.
Okay.
So the most common non-hormonal ones that you may have heard of are the barrier methods, which are both internal and external condoms. They also have the added benefit of preventing against sexually transmitted infections, but they are not quite as effective at preventing pregnancy. So there's the external condom on the left, which is the one that most people have seen. It's a piece of plastic usually made out of latex. There's also other types of polyurethane or lambskin, which does not protect against STDs, that you just put over the penis prior to having sex, and you have to use it every single time for it to be effective. The internal condom on the right here, it looks very similar to the other condom. It's a bit bigger and it has a ring inside, and you can put it inside your vagina prior to having sex. And you can put it in, I believe, up to 3 hours before having sex, so that way it's there and ready, and you just have to make sure that the penis goes inside of the condom when having it. It's a little bit less effective. It's about 79% effective compared to the others, but it's nice that you then are the one controlling the condom, and some people really like that. The only other downside of the internal condom, it's a little bit loud. It like makes a little bit of a rustling sound when having sex, but most people don't seem to mind that. The other internal barrier options are what are called the diaphragm, the cervical cap, and the sponge. And these are all things that you would put inside your vagina to prevent against pregnancy. And with all of these, you use them with spermicide, which is a liquid that kind of destroys sperm. And you have to put it in every single time before you have sex. For diaphragms and cervical caps, your doctor will help measure your cervix and find one that then fits your body correctly, because you want to make sure that it's the correct size. Because the way they work is they kind of make a seal around your cervix that then prevents any sperm from getting inside of it, because your cervix is the connection from your vagina to your uterus. And so if something that can't get past the cervix, it can't get into your uterus to fertilize an egg. And then the sponge works similar, it creates that barrier, but also you use the sponge with spermicide. And so that's the spermicidal lube, which, as the name may suggest, it kills sperm. And so those, then the effectiveness are below. These aren't quite as common, so not every doctor knows how to fit it. For people, for example, I've not been trained in how to fit someone for a diaphragm or a cervical cap, but I know doctors who can. So if my patients are interested in that, I refer them to those doctors because I don't have that training because it's so uncommon.
So if they wanted to use any of these, they have to get it from doctor's office or prescription, or where do they have to get it from?
So the sponge is over the counter. You can buy it at drugstores, and it's a sponge that you put lube in and you put it on. And then the cervical cap and the diaphragm, you usually have to talk to your doctor and get it to make sure that you're getting the right size.
So the diaphragm and the cervical cap, they're reusable. Is the sponge reusable too?
I think different brands are, but I would have to double check on that. But you do have to wash it out. I believe some are reusable, but you have to wash them out every time. And that little divot that you see, that's where you put the spermicide in.
Right.
Yeah, and the spermicide is a solution that kills the sperm. Yep.
Yeah. Spermicide also can sometimes be irritating to some people's vaginas. And so just be aware of that if that's the one that you choose, you may notice a change in your discharge, or that things may feel a little itchy or uncomfortable. It doesn't happen to everyone, but to some people.
So gabdha waxaa laga hadlayaa waxaanaytu waa wax oo la gashan karo hoos oo la istaga celin karo dhalmada also. Kani waxaa la dhahaa diaphragm, waxaad gashanaysaa hoos, dhakhtarda kuu soo qorayso, waxay celinaysaa shahwadda muu dhaafayso hoos, gudaha ma aadayso. Kana sidoo kaleete waxaad ku xiraysaa ilmagaleynka hoosaa ku xiraysaa. Laakiin waxaan yaabanahay, ma dareemayo odayga?
Usually ma dareemaan. Waxa waaye marka labada qof markii ay diyaar u tahay isku tagta markaasaa geedkan gabadha inay gashato waaye. Minka afkiis ee ku xiray. Minka afkiis lagu dhufeeyaa geedkan, the diaphragm. The same thing with cervical capka. Minka afkiisa lagu xiraa. So biyihiisa minka uga dhaafin. Right? Saas waay but usually, because ragga geedkooda ilaa meesha ma gaarayo. Yeah, and Molly, we're just talking about whether or not the man will be able to feel it, the diaphragm or the cervical during the act of intercourse.
That's a really wonderful question. I do not know off the top of my head. Admittedly, these are the diaphragm, cervical cap, and sponge are ones that are much less commonly used. Today, they were much more prevalent in like the 70s and 80s. They still exist, but they're just a little bit less common. So I'm less familiar with them. I don't have any patients on it, but I can try to find out and get back to you at our next meeting to let you know.
Okay.
Yeah. Or if anyone has any experience with it and can share, that would
from my knowledge, it's the guys can't feel it just because it's so far in. You know what I mean? It's blocking the cervix. They can't feel it.
Oh, great.
And the sponge, how about the sponge? They can't feel it either, huh?
I don't think so.
Interesting.
Because it's even softer than the diaphragm or the cervical cap.
Okay.
Also, with the vaginal ring, the Nuva ring we talked about a little while ago, most often men can't feel it either. Some can, but a lot cannot.
I see.
سعاد marka qof aan weligiis gashanin ma dhakhtarada tusaysa waxaa la geynayaa markay visitka dhakhtarka arkaysa ma la tusaa mase qofka asaga isbaroobaynayo isgelinayo because weligay waa ka cabsadeen
waa lagu cabiraa shukriye dhakhtarada ku cabirayso so every naag walba ma isticmaali karto the same size waa lagu cabiraa marka lagu cabiro kadib adaa markaas isgelinayo whenever our
Okay, I see.
So markay kugu cabirayaan mid oo size ma afkaaga meesha intuu la egyahay la fiirina marka iyaga ku tusayaan saa u gashay ku dhahayaan.
That's right, because to my knowledge, again, we're still talking about the how will the doctors know which one is the right fit for you? Usually, dhaqtarada marka ku isitayso minkaaga fiirni cabirada ka qaadaysa marka ayada matalan mid oo mid yar ma kuga haboon mid medium mid large ayada fiirnaysa minkaaga markaas ku siinaya and marka lagu dalbana aad tagtid ida ku gelinayso hubinaysa that it is a good fit inta aad guru u qaadanin.
laakiin marka qaarkood ma laga yaabaa inuu kugu dhex cararo haddii ay noqoto mase weligeed ma dhacdo weligeed
kan
waa
kan
maqlay
mukugu
laakiin
carraayo mukugu
Ay.
carraayo waxaa kale waaye marka alaabta dhaqaysid jikada sometimes sinka waxaa jirta geed lagu xiro say biyaha u bixin maho saasoo kale waaye kan it's like that haminka balaankiisa waa maan gudihiisa ma aha ma fahmaysa
cabsi waaye laakiin
is there do you all have a better diagram of
yes picture
the
or
diet because they're just kind of wondering whether or not like it what if it sort of goes into the
So the diaphragm, I'll see if I can find a picture. Probably once we get to the end, I'll stop sharing my screen and then I'll find some good pictures and then share my screen again. But basically it kind of fits from the anterior, the like front part of your cervix, goes over it and kind of like rests a little bit in behind your cervix as well. And so it kind of, it's like this is your cervix, it kind of rests just right on top like that. But I will find you some pictures at the end.
Sorry, ladies.
And then I can talk about the next couple methods as well, and then I will find those pictures for you. Next one is the withdrawal method, also called coitus interruptus. It's about 80% effective, and basically the way this works is that the penis leaves the vagina before ejaculation. And so it works because the ejaculate is where the sperm lives and is needed for fertility, and so if you do not ejaculate in the vagina, it lowers your chance of pregnancy. It doesn't work if the penis is not pulled out in time. Also, if someone had ejaculated recently as well in their pre-cum, which is the fluid that comes out of the penis before ejaculation, there can be some sperm in there from the previous ejaculation. So if you've had, if they've ejaculated already once that day, it's less effective. You can make it a little bit more effective by making sure he pees right beforehand because the urine kind of flushes out any sperm. But otherwise, really the main thing is that they ejaculate not in the vagina and also not anywhere near the genitals because if there's a lot of fluid there, sperm can get into the genitals even if they don't, and into the vagina even if you just ejaculate on the genitals. Also, it's a good idea to have some emergency contraception nearby, and I'll talk about emergency contraception a little bit, just in case the ejaculate gets in or on the vagina.
Can I explain a little bit about emergency contraception? You're talking about like after Plan B?
Yeah, and I can talk about that now if you'd like.
Okay, sure.
So yeah, there's a few different types of emergency contraception. So emergency contraception is something that you do after having sex to prevent pregnancy. What it does is it prevents the sperm and the egg from meeting and implanting in the uterus. So if you already have an embryo that's implanted in the uterus, it will not stop the pregnancy because that pregnancy is already started. But it helps prevent the sperm and the egg from getting together and preventing it from attaching to the uterine lining. So it is not the same as an abortion. None of these will cause an abortion. It is preventing the pregnancy from happening. There's 3 different ones that are oral. There's Ella, which blocks the hormones that support pregnancy, and it works for up to 5 days. Plan B also works for up to 5 days, but it's most effective in the first 72 hours. That one also helps by working by preventing the release of an egg. So if you haven't ovulated yet in your cycle, it prevents the ovulation. And without the egg, you can't have a pregnancy. And then the other method is if you have the oral birth control already, you can take multiple doses at one time to help prevent pregnancy. You will have more side effects, and there's different charts you can find online based on the brand to convert your regular birth control into emergency contraception. And then the other one is if you get a copper IUD inserted within 5 days of sex, that also helps prevent pregnancy because it destroys sperm. And then there's been a new study that came out about a month ago that shows that the hormonal IUDs can also be effective this way. And they work by helping to prevent ovulation and preventing implantation. And so these are options if you've had sex and weren't using any form of protection.
معناها waxay ka hadlaysaa hadda gabdho haddii macnaha lacala aadan rabin inaad uur qaadid oo odayga aday isku tagtaan oo wixii arrintii ay isku tagto oo aadan rabin uur inaadan qaadin waxaa jirtaa kaniin la qaato oo la dhaho Plan B waxaad ka heli kartaa over the counter. Well, actually, it's not over the counter anymore. You have to go to the pharmacy and ask Plan B, right?
Yes, but it's technically over. You have to ask the pharmacist, but you don't need a prescription
anymore, right?
Yeah.
Yeah. Farmashiyaha tagaysa qofka farmashiyaha la hadlaysa waxaa leedahay waxaan u baahanahay Plan B way ku siinayaan marka kaas qaadanaysa laakiin waa inaad qaadataa 3 beri ugu horeysa gudaheeda ama haddii aad qaadanaysid. Oh, what about the birth control? You said take several birth control.
Yeah, so depending on the brand of birth control you have,
okay.
You have to look up the chart because different ones have different doses. But basically, you have to take enough of your pills, a total dose of 100 micrograms of estrogen and 0.5 milligrams of progesterone. And so often that's taking between 5 and 7 pills, depending on the brand. So I always, every time, depending on the brand, I look at the chart because it's too hard to memorize all the different brands and the amount that you would take. Most people have more side effects with this because you're just taking so many more pills. And so it's good if you aren't able to get to a pharmacy and you have some birth control around, but it's also a little bit less effective.
That would confuse me. I'll just go get my Plan B.
Yeah.
Safe side.
Oh, I have a question.
أما وحاسة ها بايو.
السؤال أنت قبل Plan B قاسيته ما مركه هور أنت هذا اسكت جينا قاذنة ما مركه اسكت تينا قاذنة.
After اسكت تكتان.
أو after اسكت تكتين.
Yes, after اسكت تكتان أو أرنت محلها أو let's say in محلها let's see in because before this slide وحكي هاللي سموكتها هي natural birth control معناه حكي كتير هذا بنانك أصوبحي أضيق بنانك هأصوبحيو هدي لعلى أو وإسئلوا إنه بنانك أصوبحيو أذن أد أمليسد وقتي إنا كجرتي أو الماء دليسد أو كله وقتي معناه الماء أور ماين المقلين كاجا أصله ده هي أما أورقا دا مركزيتو هاي ستا 75 hours window أكو قاعدين محلها Plan B so then مركز فرمشيها واتجي كرتا وحسوا قاعدين كرتا Plan B جا وقاعدين كرتا Plan B جا ما أهن إن abortion أسمينه سد ما أهن just محلها وحيك هور استاجسا in
جيركا هرمون كيسا بدليسا
وكا جيركا هرمون كيسا بدليسا بس تاسوا
الماء يكو أبوه منها
ما وحو أنا عن شورس كفر جريا أو ما وح قفل بقى جدًا كرواي أو أفور جرين كرواي
قفل هو أفور جرين كرا هرتي وحي هنجرتي prescription على وصو قرا أنت لقى دعا كاس لقى دعا هدرتان you don't even need prescription and it's not actually that much it's like about $60 ميل هاسوان.
I think insurance does cover it, but I'm not sure. Does the insurance cover it?
Insurance covers too.
I think it depends
if you
on your
have insurance. You can buy in with your money too.
Oh,
yeah.
Thank you.
أول على المهاد الكرام.
Yeah, go ahead.
باي أنا أفر مرة اللي قلي أن قلنا هاي هذا لو بلاد نجوجا. إن ربنا هذا قرب كليس جيلنا ينساق على تلاش كل درة تنلس جيلنا ما سدح بلاد. بيش هذا نقدر ماني سليح طبعا كذي. أفر معلم مركان جوجا ديك فرن كيقول بلاد إلا هذا وياها.
Okay.
دكتور كانوا يقولوا على بعض ويجوا هراء أبوي يقول علني سا أبوي كاكيني سا لا ولا نقنيسا.
Okay. كل معناته وحتى هذا يوالو قلي.
أفر مرة اللي قلها أسبوع حكتو.
Okay. المال لو قلي.
هذا بيش اللبات لبدي ده تعمل قدام بيالله يقول هذا لباب بلاد وجراه.
Okay.
بيش هذا نقدر معطي بيش سدحاد لحية طبعا كذي على لا يوصل لفته البضة قرب كلاس كقدراي.
هي okay.
ديك فرنا انتقاد إلا هذا ديك إيه ما هذا هذا ويقص صعبة.
Okay. So this mom's had she had a C-section 4 times. The last time she had a C-section was 2 months ago. About the 16th of last month, she did have the implant. But since then she been
Depo why she had Depo.
Oh, معناته عربد أو وحما لقى رفتي إن قربك.
طلع اسكو فينا وايا طلع اسكو سارة معها ولا سجلنا معها. tan
Oh,
saddexda sano maaha tan saddexda bilood
okay, saddex bilood. Okay. She had it go, and then she's been bleeding since the 16th of last month. Is that normal?
It can be, yeah. So it can be normal to have that residual bleeding after a delivery, and also with Depo and any of the ones that are progesterone only. Kind of, some people stop having their period, some people have normal periods, some people have spotting, and some people have a light period that's just kind of continuous. Um, so it can be normal. If you're bleeding quite a lot, though, I would talk to your doctor and see if it is too much, but it can be normal to just have some light bleeding continuously.
أنت dhiig badan ma ka socda mise dhiigii yar waa?
wax adig ma badno mana yara laakiin maba iga istaagayo dhowr maalmo iga socdaay ilaa hadda
waxay ku leedahay normal waaye laakiin dhakhtaradaada ma la hadashay markaa la hadashay maxay ku tiri?
maya ma u sheegin ilaa hadda sababtoo ah markii oo cirbadda laygu dhifanayo waxay ugu dhahday labada wiiga ugu horeyso intay cirbadda jirkaaga la qabsanayso xoogaa dhiig inaad isku aragtaa laga yaaba ama aad isku arkin ay dhahdo
okay caruurtaada meeqa sano ay kala waaweyn yihiin?
2 sano.
Okay. Yeah, she hasn't talked to her doctor yet, but she's going to. She's been bleeding, but not too heavy, but not too small, but kind of moderate.
Yeah, I would recommend talking to the doctor because they may be able to help you, and since they know you best.
معناته ballan sida ugu dhaqsaha badan sameeyso ee la hadal.
because gabdhaha cirbada qaato badanaa waxa waaye waxay isku arkaan xitaa feerooda daciif ay noqotaa. So make sure maxaa la dhihi jiray abaaye cuntada oo jirkaaga feerada oo dhisayso ama daawada feerada inaa qaadanaysid, especially maadaama hadda dhashay.
daawada feerada tee
tan oo iron tay dhahaan.
tan caloosha loo cunaa
may tan oo dhiiga dhisto
oo vitamin miya
daawooyinka dhiiga dhiso gabdhaha marka lagu sheego dhiigooda inuu daciif yahay markino ama
feerada daciif daawooyinkaas waa isticmaalaa
kaas sii qaado haddii kale waxa waaye oo adoo hadda dhashay oo 4 ilmo dhashay ay kugu qaleen haddana dhiigaada si xun oo saa kaaga socdo marmar qofta waxaa isku arkaysaa daalitaan ziyaad ah isku arkaysaa marka daawooyinkaas laazim iyo cuntooyinka sida markan oo baarka ama hilibka gaduudan iyo waxyaabahaas qudaarta iyo waxaas oo kale
spinachka iyo cagaarka badso isku dadaal macanto
walaalahay meel dukaanaan gelin rabaa gaarigan ka baxaya waa idin salaamaya marka
Okay, go ahead. Sorry.
Okay. And then the last thing we wanted to talk about was the fertility awareness method. And so with the fertility awareness method, it's about getting to know your body and getting to know what days you are fertile and not having sex on those days or using another form of contraception like a condom or spermicide on those fertile days. There's the caveat is if you don't have regular bleeding every month, if you don't have a regular period, these do not work very well. And you just have to be very diligent about checking things. There's 3 main methods that you can use. There's the temperature method, which is about checking your temperature every morning. And this is even before you get out of bed, you check it. And you do that for at least a month and check the fluctuations in your temperatures. And so you then have safe days and not safe days, and you look at it on the calendar. And the safe days for the temperature method is when you ovulate, your temperature goes up. And then, so the safe days begin after the increase in your temperature for at least 3 days, and then ends right before your temperature drops when your next period begins. So during those safe days, you can have unprotected sex. The cervical mucus method is a similar thought process, is that your cervical mucus changes as different parts of your period. And there's both vaginal discharge and cervical mucus. So for this, you really have to be a little bit flexible and reach your fingers up to your cervix and get the mucus there. And then feel how it feels between your fingers and the stickiness of the sorry, a little burpy, or the runniness of it. And also you need to chart it for at least a month first. And you want to then avoid sex for one whole cycle during that time. So that way you can get to know your mucus. And then the unsafe days, the days not to have sex, are 2 to 3 days before the slippery mucus and 3 days after the slippery mucus. So you need to do the first month to track when your slippery mucus begins and see that pattern and where it is in your cycle. And often this can take at least 2 cycles to figure that out. And then you're able to predict on the next month what your mucus will be, because you want to stop having sex 3 days before the slippery mucus starts, and then continue to not have any sex until at least 3 days after the slippery mucus ends. And then the last one, the calendar method, I didn't put a detailed description in here just because it is the most, a little bit complex one. You have to track your cycles for at least 6 months, and then you take whatever was your shortest cycle, and then you subtract 18, and then you use your calendar to figure out the days in which you are fertile and days in which you are able to have sex. All of these methods are described a bit more on the Planned Parenthood website, as well as some websites I included at the end. So if you're interested more in the calendar method, I would recommend looking at that and reading the table to learn how to make your own table, because it's a little bit more complex than I feel like I can adequately describe here.
Okay, so gabdho maxaa la dhahaa waxaan hadda ka hadlayso horta wax anaga dhinaca diinta xataa aan ku dhaqanno waaye more waxaasaan u explain garayn karta faiso so temperature-ka chega maxay dhahaan marka laga hadlayo gabadha islaantan ka hadlayso so ma ahan gabadha haddii rabto macnaa inay check garayso maalmaha waxay leedahay macnaa ukunteeda ay samaynayso hadee ninka ay tagaan macnaa ay noqonayso inay ur qaadayso kale waa maalintii xoogaa iyadoo qandho ay leedahay oo kale ay soo kacdo waa maalintaas caadada ku dhacdo ay ka dhaqato 2 beri ka bacdi Soomaan
waxa waaye temperature-kaaniti horta subax walba markii inaa fiirso wasirta inta soo kicin inta oo musqushi iyo macna waxyaabo isbedel jirkaada ku dhicin markii inaa temperature-ka iska qaadi waaye the moment aad soo kacdid geedka temperature-ka sirta agteeda inuu ku yaalo waaye waa fiirinaysaa markii ay maxaa la dhihi jiray ovulation oo jirkaaga oo sameeyay ukunta jirkaaga markay soo deeyo waxa haysataa 24 hour in ukuntaas ay waxa noqoto ilmay noqoto so ukunta markii jirkaaga oo soo deeyo temperature-kaaga oo jirka kor u kacaa marka maalin walba for instance haddii aad temperature-ka iska qaadaysi oo ahay 98.8 camal oo ahay maalinta oo jirkaaga diyaar uurku u yahay wuxuu sameynaa temperature-kaaga kor u kacaa markina waxaa laga yaabaa 99 wax la jiro inuu noqdo xataa ama 100 laga yaabaa subax markaa soo kacid waaye marka maalintaas waaye iyo ay maxaa la dhihi jiray maalintaas ilaa 2 maalin kadib ama 3 maalin kadib waxba inaa sameynin ninka isku tegin saas waaye before and after waaye marka maalintaas waa maalinta khatarta ah oo jirkaaga tamarka marka kuleel oo noqdo inaa isku tegin waaye ninkaadii adig and the other thing to remember
haddii rabtid maalmahaas waa maalmaha isku tegaysa
maalmahaas waa maalmaha gaagaadaysid because gabdhaha ukunteena 24 hour kaliya ay fiican tahay after 24 hour waxay noqonaysaa caaday noqonaysaa that's it like ragga biyahooda ilaa 3 maalin waa ku jiri karaa jirkaada matalan haddii oo adigaada isku tagteen maalin 2 maalin ka hor inta adiga ukuntaa jirka soo daynin markina still uu waa qaadi kartaa because nimanka biyahooda ilaa 3 maalin ay ku noolaan karaan maxaa la dhihi jiraa ilmagaleenka taasaas waa tan mucuskana waxa waaye ay sheegayso haddii aad aragteen jirkeena dhacaanka oo siirkaada waa isbedelaa markii caadada ka dhamaysatidoo kale markina dhacaan fiican ma leeyihin laakiin markii caadada kuusoo soo dhowdahay ama jirkaaga diyaara uurka u yahay dhacaan waxaa arkaysaa oo clear ah oo jiijiitamaya sida ukunta shaarkeedoo kale marka taas aragtid markaas waaye markii jirkaada oo diyaara u yahay uur inaa qaadid marka maalmahaas inaa ninka isugu tagtiin ma aha maxeelsha midda kale waxa marmar wuxuu noqonaa wax cad oo laakiin oo dhaadheer oo jiijiitamaya oo sida oo wax camal ma u jiitamaya ukunta shaarkeeda camal ma aha kan ay sheegayso waxa waaye it's clear waan jiijiitamaa sida ukunta shaarkeedoo kale marka jirkeena dhacaanka oo soo daayaaba oo kala ah marka dhacaankaas inaa u fiirsatid waaye oo maxaa la dhihi jiray dhacaanka isku aragtid oo biyo marmar xataa qoyaana dareemaysa adoona fiirinin markino maalmaha oo jirkaada diyaar uu ku yahay marka waxaas waa wixii sheegayso markaasaa isku aragtid again 2 maalin 3 maalin kadib inaa odagaa adan isku tagtiin ma aha haddaa isticmaalaysid mix check methodka kan kalena calendar waaye calendarka xogaar see sheegtay little waxa waaye complex waaye because dadka qaarkood caadooda 28 beri kuwana 30 wax la jiro qof walba si waaye marka kaas waxay ay nii sheegaysaa link ama Planned Parenthood ay leedahay taga website-kooda kala socda kaas marka kan calendarka xogaar waa ka duwan yahay kuwaanayta kale
ani calendarka waa isticmaalaa calendarka waxaan isticmaalaa oo maxaa la dhahaa ay dhahayaan period tracker. I'm telling the girls, I said I use the calendar the one that says period tracker.
Oh yeah, there's a lot of good apps that can help with it. Yeah.
Yeah, so I use that one, and when it tells me I have a 1 day left my period exactly, I always have that 1 day period. The next day it comes and also tells me when I'm ovulating. I can tell it when I'm ovulating. It tells me when I'm releasing my eggs that day. I don't know how. I don't follow it, but I kind of play with it sometimes, and it I don't know. But it helps me out a lot, especially with period, especially when it's regular. Those who are not regular, I don't know about it, but mine is regular.
Yeah. If you don't have a regular period, you can't use this method. But yeah, I was going to mention there's some really great apps. My Period Tracker is one. Clue is another app that a lot of people
I can
like.
write it down here for you guys. This calendar, I use it. It's very nice.
And then فايزة هذا أو ما تصنت هرتو حيالا بدنا أنا أجينا بهذا عماش كمقل لكن أنا وحان ربي أبدا إنا تنبجر كوجا أنا قف تنبجر كيسا مو مالينا ولقي تنبجر هذا ما في لكن وح كلا لو قرن كرم جرا أو بعد جاجا أو لقى دريمة أنا نهين تنبجر وقف كله قف عايز تنبجر أو سفيرنا يا مالها إلا أنا اسمه أنا قدرت كنا كذا يسوي وح كلا لو قرن أو بعد جاجا oo ka dareemaysa ma jiraan
dhacaanka is the other thing hadii temperature qofka oo isdhehaysid marwaba ma fiirin karo for like I don't know for isbuucyo before caada because saadaayta sheegay gabadha you have to get to know jirkaaga xataa inaa ogaatid waaye macnaha you can't just start using it right away inaa fiirsid waaye bil labo bil temperaturkaaga isbedelkiisa markino the same thing with
hadda markaa dhehayso kale hadda kale markaa musqush tago kale waa arki jiro waxaas dheerayo sida adheys ukunta shaarkeedo kale hadda I was like wixii way isqabanayaan ba laakiin qof hadda ilmo dambe Allah yaclam laakiin qof hadda ilmo dambe dhalayso oo diyaar uma ekiban laakiin waxaan rabi lahaa inaa ogaado maadaama gabdhaha la dhasheen wax kale ku dareemayaan waxay tahay biyahaas oo kale ay arkayaan oo kale
dhacaanka is a very telltale qofka hadii if you're in tune again dhacaankana waxa waaye gabadha markay naas muujinayso you cannot rely on the mucus because it's different markaa naas muujinayso because jirkaaga waa hormoonkiisa waa isbedelaa markaas with breastfeeding marka laakiin maxaa la dhihi jiray gabdhaha badigooda oo mar hore waxa ugu dambeeyay ilma dhalitaanka mucuskaaga waa saxan yahay haddii caadada bil walba ay kugu dhacdo mucuska asna saasoo kale waaye asaa kala ah mucuska maxaa la dhihi jiray midkaaseti laakiin oo mid waxaa jiro si waxa u malaysid markino sida duufkoo kale that one usually waxaa isku arkaysaa markaa dhaaftid ovulationka markaa dhaaftid isku arkaysaa right before caadada ku imaanin waa isbedelaa laakiin before caadada adi 10 beri dadka qaarkooda waxa waa 7 beri after caadadooda ay isku arkaan waxaan jijiitamayo oo sida ukunta shaarkeeda temperature xataa dad waxaa jiraan fiirin like ani ma fiiriyo temperature laakiin caadadka ii soo socoto waa dareemaa jirkayga dadka kale guriga jooga waa ka qaboban yahay mara arkaysa ani le qabow ahayo waxaan gashanaa funaanaan gashanaa hiidka dheereeya dadka kale dhanna caadi waay marka that's it's another way lagu fahmo jirkaaga wax inuu isbedelayo temperature-kaaga
so sorry inaan tan ka hadlay yani ma dareemay kasoo qabo kale marka dhiiga oo ku soo socdo kale inaa qofka dumarka kacsi badan dareemayso wax jira miya أنا أسكو so كعس بدنا أسكو أركا
exactly markii ukunta because jirkaaga diyaar wuxuu u urinoo qaado so it's around that time naagaha libido what kusiyaada markaas
aduu rabiyaa because ma rabo caadada inay ku dhacdo
xataa dadka qaarkood waxaa leeyahay markino wejigaada ku guduudanayo jirkaas
ها
gaabka
أنا
u
ساسا
tegin
نقضة
meeshaan
ah yep yep
meeshaan guduna he also itch cuncun markino mar ani cuncuna raaxada iga qaadaba horto I don't know why. Is it Maya, is it normal like before period to have an itch, like a vaginal itch, and it's not like an itch for like it's not an itch for like yeast infection, all that stuff. It's just the itch on top of the vagina, not inside.
So it can be normal to have different changes in how you feel, um, especially in your genitals right before a period because you are having different fluctuations of hormones. I have several patients who are like the day before my period, my vagina itches, or the day before my period, my vagina hurts in a way that almost feels like a burn, but not.
Yep,
Um,
hurts. Yep.
Yeah, and those can all be very normal. If you're noticing a lot of itching or a bad smell and discharge, you can always go and see your doctor and try to time it to be the day before your period so they can look and see if there's anything that's concerning.
No, not it's just the itch. I don't know. It's just the itch is outside, not inside.
Yeah. It could be normal, but I think also I would say see your doctor just to double check because I would want them to just look at the outside and see if there's anything concerning. And then I also realized I forgot to put it in the slideshow, but a really great hormone-free method that is up to 99% effective is breastfeeding for the first 6 months of
that's my favorite.
the first 6 months of breastfeeding. It is 99% effective if you are exclusively breastfeeding and not doing any formula and any supplementation. Once you start introducing any food to baby and they're getting any nutrition outside of breast, you can then be fertile again. And then the one warning is you release your first egg before your first period. And so you become fertile 2 weeks before the first time you have a period again after giving birth. And so it is possible to get pregnant at that 6 month time because your body releases the egg before you even realize that you're fertile again. So at least for the first 5 to 6 months, it is up to 99% effective if you are exclusively breastfeeding. And I think that brings us through all of the methods that we had brought up today. I really appreciate all the questions people had throughout, but also if you have more questions, we're happy to share. We also, here's some resources. These are our three favorite websites for looking at different contraception and birth control choices. I like the Planned Parenthood website. You can search by like, oh, I want one with lower hormones, or I want one that I don't have to take every day, and they have nice filters to help you find it that way. The reproductiveaccess.org one has a really great fact sheet that kind of lists them all and their risks and benefits of each one. And then bedsider.org I like, it has a little quiz that you can take to say, oh, this is what I'm looking for in a birth control. And then based on that, it suggests ones that might work for you.
Awesome. It's great.
ما tusaysaa ma sawirkay tiri waa idin tusaya haddaad
Oh, are you going to show that picture about the diagram?
Oh, yes.
Maya, I put it in the slide deck that we have. I'll try to find a way to get it into the chat.
If I stop sharing and then reload it again, I think it might be in there. So let me try that. And let me.
You could also just maybe send the link into the chat and we can click on it and open it up either.
Yeah, did you add it to the Google Doc or the SharePoint?
The SharePoint.
Oh, now I see it. Okay. Yep. Oh, it was there. There we go. So this is the picture of the diaphragm of a little bit more of what it looks like and where it goes inside of you. people are able to see. So you slide it in and then make sure it sits right on top of your cervix.
So marka iska soo bixinaysidna se u soo bixinay gacanta lama soo gelina hadhow.
Yes, waxa way squeeze on qana. Gacantaada gelinaysa dab aad soo siinaysa. It's like the nose ama way cervix, you know, it's a little hard and rough. Aftiisa to adoot marka soo waxinaysid gacantaada gelinay, you squish it and then you take it out.
Was that what?
Thank you.
What other questions do people have? I realized we gave you like a ton of information all at once, and it can be overwhelming. But if you have any questions or thoughts or concerns about the different methods, people might always say, oh, this is the best form of birth control, this one thing is the best, or this other thing is the best. I personally don't agree with that. I think the best form of birth control is the one that's best for you and the one that best fits your goals and needs as a person who's trying to prevent pregnancy. And so some of them, so it's really about finding the one that works best for you as opposed to the one that someone else might say is the best.
And sometimes it can just be a little bit of trial and error too, because sometimes it's hard to know how the hormones or the different patterns are going to affect your body. So just because you try one and you don't like it, or you have breakthrough bleeding, doesn't mean that you won't be successful with another kind. And it's safe to switch between them.
And Abay Suad. Faisa ma joogtiin Abay ama Suad?
شكري ما هو وحكوا عاصي واي
ها شكري
حاولتي له واي
وأنا waxaan rabay maadaama labadii hadda gabdhihii meesha ku jiray anigana aan qabso waxay tahay ifis hadduu qofkii waxay dhahayaan qof walbaba waa inuu u shaqeeyaa wixii u shaqeeyo aniga hadda weligay ma isticmaalin laakiin qof walba wixii u shaqeeyo labadii gabdhood ee hadda hadlay uu su-aasha weydiiyeyna waa dhaqaatiirta u samaysay u dhahday choice u samaysay oo maysan samaysan iyaga so qofka oo aanan af ingiriis fiican aqoonin sidee marka uu qofkaasi uu helayaa inuu midka u roon uu helo haddiiba qofkii dhakhtarka uu juus garaynayo haddana waxba sameeyo garan karaynin
shukri oftentimes waxa waaye abaaye midaa try garaynaysaa waa arkaysaa inuu kuu shaqeeyo in kale markino haddii matalan abaayadii haddoo kale oo dhiiga ka socday oo cirbada qaadanaysay you know I know hadda mar dhawe wax dhashay sometimes with debooda inaa siisid waaye laba bil inaa siisid waaye marka weli haddii weli dhiigii sii socdo waa iska bedeli kartaa mid kale oo ku bedelin kartaa iyadoo kale ma fahmaysa marka waxa waaye it's a try and error waaye sometimes ma ogaanaysa ka kuu fiican the first time maxaa la dhihi jiray fiirisid marka saas waaye that's how it is marka waxaa laga yaabaa haddii ay maxaa la dhihi jiray asi laba bil kadib ee weli wixii socdo ee iska bedesho matalan IUD ga try garaysa camal IUD inay ka heshaan dhici karto ama sometimes waxa waaye mid labo ama maxaa la dhihi jiray saddex oo waxa inaa fiirisid waa before helin midka adig oo maxaa la dhihi jiray ku anfacaya ama midkaa ka heshid so that's why unfortunately the first time qaadatid ma ku wada shaqeynayo but it's good inaa wada ogaatid waxyaabaha qaarkooda ee side effect ay ku keeni karaan so that way haddii arabtid oo taas okay kula tahay it's fine matalan debooda waa lagu yaqaanaa dhiigga inay ziyaadiso oo marka koodii jirkaa intoo la qabsanayo at least waxaan arkay ani gabdho ilaa 3 bil maxaa la 6 bil qaadanayo kadib oo caadi isku saxayso before then oo like in bishii laga yaabo 2 isbuuc 3 isbuuc inay wax isku arkayaan dhiig marka it depends marka qof walba waxa waaye you can have to find it which one is good and unfortunately sometimes
I hope inay saas u og yihiin iyagan hadday ku jiraan qolka ay isku dayaan haddii la shaqayn weyso
ma aha dadka qaarkood waxay leeyihiin IUD ama IUD gabadh saaxiibteeda u shaqeeyay laakiin marka ayaga ay qaataan IUD laga yaabo dhiig inay isku arkaan ama IUD oo ku carro, you know, all that stuff. And waxaa dhici karta gabadha in iska wada joojisabo ee dhahdo maba rabo waxaan. Laakiin always it's good inaad isku daysid multiple ones because uur qaaditaan san walba dhibkiisoo leeyahay maxaa la dhihi jiray asi xataa because jirkaaga waa ogtahay gabdhaheena uurka marwalba uuraa qaadid jirkaaga waxa kasii dhimaya, you know. Marka waxaa u baahan tahay jirkii waqti inaad ku siisid oo kusoo kabsado before cunugii kale uurkiisa qaadan. So that's why it's good inaad isku fiirisid multiple to see which one aad jeceshahay.
Lakin Faisa, what I don't understand is that mom who maxaa la dhahaa had a 4 ilmo oo lagu soo qalay oo hadda la soo qalay debo se siinaysaa ogti debo inuu naagaha ay ku dhigaan because debo always naagaha way ku dhigaan. I don't understand.
Sometimes naagaha uura yeelan karaan ayagoo xataa caadada markaa ka dhaqansido kale macnaha dhiigga kaa dhamaado dhalmada markino uur waa qaadi kartaa taas darteeda u samaynayaan jirkaaga inuu ula qabsado hadhowta markaa caadada ka dhaqansid ama haddii dhalmada macnaa dhiigga dhalmada uu kaa istaago odagaa isku tagtid
sorry about that.
uur u qaadan kahor
gabadha markaa hadda especially qofka markuu dhalo it's really hard to know caadadeedii runta maa kusoo noqotay mise daboodiyaa keentay, you know, all that stuff. Marka laakiin waxaan waxay keento waa iscaado. It's not like dhakhtarka you know wax qaldan oo sameeya.
And the other thing I want to ask Mali in the other position is that for somebody who makes a lot of estrogen, what kind of birth control do you recommend as a physician?
So is this someone who has like PCOS?
Yeah.
So a lot of them can be really effective because as long as you're giving them progesterone, which all of them have besides the non-hormonal ones, you can help regulate their cycle. And so we just need something to help stabilize the lining of the uterus. And so sometimes that can be birth control pills. Sometimes that can be the IUD or the Nexplanon. But with PCOS, there's certain pills that you can take that have less of an androgen effect, which is less, and people with PCOS often have higher androgen levels. So you would want to pick a pill and talk to your doctor about picking there's a few brands of pills that are this that have less androgen that can then be more helpful in someone with PCOS.
We also didn't talk about this a ton, but sometimes birth control pills can also be used for people who have really, really heavy bleeding. Like Maya was saying, it can help regulate your period so it can make bleeding more regular and less heavy. And then for some people too, some people have hormonal acne. Some people can get benefits and have improved acne from birth control.
For real?
Mm-hmm. Yeah.
We use it really commonly.
A lot of teenagers are on birth control for the acne benefit. Or at least that's what they tell their parents.
Yeah.
Oh,
it's really cute. Yeah, and just to add on that, some women who are having irregular periods too, they put on birth control to sort of make it, so especially people who are trying to
and that's why I think one of the reasons why we get so frustrated that the government tries to regulate birth control is that it's benefits so many people for so many different medical reasons, and it's just has a lot of benefits.
Mm-hmm.
Why is the government meddling with birth control?
Oh, because they're judgmental and don't feel like they should. There's people who don't feel like insurances should pay for things that can allow people to have sex without having children. Because they want to control people's bodies. That is my bias entering, but the thought process is they feel that the people who advocate for this often feel that sex should only be used if it's for procreation, and therefore birth control pills would go against that. However, birth control pills has many more uses than that, and also we have a separation of church and state in this country, and so.
Oh yeah, I forgot all about that.
Yeah, so therefore, their religious beliefs should not affect government laws.
You know, there is a country in Europe, I forgot what country was that. I was reading the other day somewhere in Facebook, they said birth control and pads and everything that, women's sanitary is free. I was like, why can't we just have that here?
Scotland now has free
Oh, yeah.
sanitary pads.
Yes.
And
There you go. That's
Mhm.
Scotland.
yeah,
Yep. Yep, that's right.
yeah,
Oh, here we pay tax. On
Yeah.
our sanitary, we pay tax.
I know.
I mean, we're paying with our own money, but we pay tax. I'm like, can we just have for free? Hello.
It's absurd.
Yeah.
There's a question in the chat about for people with chronic migraines, which birth control might be best for them.
Yeah.
I just want to address, it depends if your migraines are associated with your period. Being on a birth control that has both estrogen and progesterone might be helpful because it suppresses ovulation and that fluctuations. However, if you are someone with a migraine with aura, meaning that you sometimes see changes in light or changes in smell before getting your migraine, you cannot be on a birth control that has estrogen in it because that will put you at a higher risk for a blood clot if you have that specific type of migraine. So I would talk with your doctor about kind of what are you looking for in a birth control. And if it's you've noticed that your migraines are associated with your period, being on a birth control can help with that too.
Sorry, did you say if you have auras with your migraines, then the estrogen ones? Can you repeat that?
Yeah, if you have auras with your migraine, you can't use estrogen, or it's much less safe to use estrogen because there's a higher risk of a blood clot, specifically if you have migraines with aura. If you have migraines with aura, then you can use the pill that has only progesterone. You could use the shot, the implant in your arm, or the IUD.
Thank you.
Is there a woman in the world that cannot take any birth control in the world?
So there will be people who say yes. However, people who are at higher risk of complications due to birth control, due to concern for blood clots or other things, those same hormones that are in birth control happen during pregnancy and at much, much higher levels. Therefore, for people who it's risky to be on birth control, it's probably even more risky for them to become pregnant. And so it can then be a discussion with their doctor about the risks and the benefits and understanding the risk of the birth control, but that it's probably a lower risk than being pregnant. And for people who that's the case, you can be like, hello, partner, get a vasectomy.
Oh yeah, that part. Somebody was saying earlier, we're talking about penis finally. Well, who's
Yeah.
that? Let me guess.
Yeah.
No, and my own sister, probably.
But yeah, vasectomies are amazing. And like the recovery is so easy. It's in the office. It's like they numb it up. It's such an easy, simple procedure.
And then they get out of the same day.
I know. It's like less than 30 minutes.
Wow.
And in some it's reversible on up to 75% of the time. So it's
What?
depending on the method they use. And so, you know, I think it's a wonderful option that people don't utilize enough because we often think that birth control is the people have uteruses are the ones who have to think about birth control. But I think penis-bodied individuals should be thinking about it just as much. And
I just took it the screenshot when you were talking about that.
Yeah.
Just send somebody.
A gentle hint.
Yes.
Yeah, and with the vasectomy, they can still ejaculate. They still have the same amount of sexual pleasure as before. It's just that sperm is not in the ejaculate.
Yes, it's not. Yeah.
It does nothing to affect their masculinity.
I like that. Yeah, that's good idea. Interesting. Any more questions? We passed our time tonight. Yeah, this is really good. By the way, ladies, we'll have these ladies again and the first Saturday of each month until we conclude everything. Yes.
I hope this was helpful.
Oh my goodness, you have no idea.
It was, yeah.
Have no idea.
Thank you.
It was, yeah. And I can't wait until we talk about menopause, perimenopause, and all that stuff.
Yes, I can. They should have. I'm going through that, so I need that as soon as possible.
All right, we can. I'll talk to the Amelia, who's the organizer of us being here, and I can let her know that people would like perimenopause and menopause as the next topic.
Oh, yeah, let's take a break of birth and then let's skip that one and then go to that one. Yep. Thank you so much, ladies. Anybody have last question? Because we're going to end soon. Oh my God, 7:45. It's Saturday night.
Yeah.
It's 6:45, Saad. You're looking at your other clock that you haven't rewind yet.
Oh, it's right. Yeah, other time I haven't rewinded that.
I know you. Yes.
Suad.
I forgot. Oh, there's always one clock at the house. You never rewind it. It always sets on 1 clock. Oh, thank you for coming, ladies. I appreciate it. We'll see you guys next month.
Thank you so much for having us.
Oh, anytime. This was nice. Ladies, next week we bring anybody in your community or friends, family. We are going to have a special guest from, I forgot where, but we're going to be speaking about legal, immigration, housing, anything. Please, 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 please. And if you guys want to, you can join us too. It'd be great. Yeah. So thank you. Thank you guys for coming. Appreciate it.
Bye,
Have a
everybody. Thank you.
Thank you. Thank
Have
you.
a great weekend.
Bye.